Okay, let's get started. Welcome to today's information session for the Masters of Science in Healthcare Leadership, offered by the School of Professional Studies here at Brown University in conjunction with the School of Public Health. Our session today is about investing in yourself, your potential return on investment after completing an MHL degree here at Brown. So we're going to focus a bit on that today. I'm Sandi Ferretti. I have a similar type of degree. I have a master's in health services administration, and I worked in healthcare for about 20 years before coming to Brown, and have worked with this program since it began. So I have a really good understanding of all the types of students who've been through the program and how they have leveraged the degree to further their career. So I'm the program director, and that means I keep the trains running and everything from soup to nuts, from student activities and issues, getting you registered and enrolled and all of that good stuff, as well as assisting faculty with curriculum and all sorts of fun activities. So we're going to ask that you use the Q&A function in your Zoom menu bar to to pose any questions that you have during the session. And I'm going to run through some slides, and then we'll address questions. My colleague Emma is here with me today to help facilitate those activities in the Q&A session. So as you think of those questions, please enter them in the Q&A section. You don't have to wait until the end to enter them in, so just go right ahead and do that. All right, so this session is about investing in yourself. Healthcare, as you all know and as you are experiencing today, is a really challenging place. And so that makes us all question what is our why? Why are we in healthcare to start with? What do we hope to achieve? Um, what do we hope to achieve both professionally as well as personally? And how are we going to get there? And what skills do you possibly need to grow and be able to get there? So what does return on investment mean when you're thinking about education? In the business world, return on investment is really measured by the profit, what's left over from producing and selling a product versus the total expense or cost of producing that. So pretty straightforward definition. When you're talking about education, it's a little bit harder to calculate because you're talking about what gains you might gain in a lifetime of earnings compared to your tuition that you invest initially in a program like this. So a little bit more tricky to give hard numbers on, but hopefully you'll hear some big statistics as well as some individual success stories. So in our alumni surveys, we've learned that our students have told us that 60% have reported that they've been promoted to vice president or C-suite. 67% report a significant salary increase, and 73% have received a managerial level promotion after their time in the MHL program. So this is a sort of broad-based alumni result. But I would like to point out that there's much more than just the financial gain of earning a degree like this. You gain a network of peers across the healthcare spectrum. You have an alumni network of over 200 alums right now in key positions throughout the United States and abroad. Enables you to make a career pivot because of the broad base of knowledge you get. The program specifically works on your own personal leadership skill development and provides leadership coaching for you, which I have not seen anywhere else in this space. And also provides that foundation of knowledge that broadens your capabilities to function in any healthcare setting. So let's talk specifics. What are some great examples? And I've got a number of them here for you, so bear with me, of how students have advanced or changed their careers after the program. So what you'll see here are several slides where it's on the left-hand side is the title that they held before the MHL program and their current role right now. So this first slide is about clinicians, physicians specifically, who have completed the program and have gone on to do other things. We have lots of different types of clinicians: nurses, nurse practitioners, PTs, OT, respiratory therapists, CRNAs, a wide range of clinical roles, and they have all experienced career growth. But for this slide, I'm focusing on some of our physician executives who've advanced. So the first example is an ophthalmologist. He was in a general practice, group practice on his own, doing lots of surgeries and all that good stuff, and was ready to move to a new career. And he is currently a founding assistant dean for clinical education at a new medical school in the state of Kansas. We have an OBGYN, practicing OBGYN, who was a chief of women's and children's service line for a large medical group practice in New Jersey. And she has continued to advance at that same organization, and now she's a chief medical officer for what they call the New York South region. We had a student who was a maternal child health fellow. So it is possible to do our program while you are in a fellowship program. And she wanted to continue to be, she definitely did the program because she wanted to lead in the public health arena. And she is now an associate medical director for the New York State Department of Public Health. So pretty exciting for her. We have a nephrologist who was a practicing nephrologist who completely left clinical practice and is a senior medical director at Optum, working on clinical care paths, data to help providers provide the best clinical care possible, really working at things from a data analytics, taking that clinical perspective and the data analytics and bringing those two things together to educate practitioners on best practices. And finally, we have an example of a chief of a Department of Emergency Medicine who is now a chief medical officer. And let's see, he's also now president of the facility. So he's president and chief medical officer. So terrific opportunities. So I want to emphasize that not everyone in the program is a clinician. Only maybe 20 to 25% of our students are clinicians, and the rest have other types of management and leadership roles in healthcare. So here's some examples of other types of professionals and the types of success that they've had. So one gentleman was in a finance organization doing healthcare financing. He was a senior vice president. He came in with an amazing idea about how to redirect or rethink the supply of blood products in the United States. And so he is currently the CEO and founder of a company called BloodBuy, which has been an active company for 10 years and very, very successful at addressing the nation's blood shortage and how to get the right blood products to the right place at the right time. We've had people in the pharma sector who one was a vice president for technical operations at a large pharma company and is now CEO of Aprecia Pharmaceuticals. We've had a person who's a director of global strategic sourcing at a large pharma company who moved to a smaller company you might have heard of called Moderna just before the pandemic. And she's the executive director for procurement for Moderna and has obviously done some amazing things throughout the pandemic and post-pandemic. We've had folks in the consulting arena. So folks who started out as a managing consultant and who are now director levels in consulting companies. So if you know anything about how consulting works and the sort of levels of consultants, that's sort of the next step before partner is being a director in consulting. We had a person who was a chief operating officer at a single federally qualified health center. Granted, it was one of the largest ones here in Rhode Island, but she is now a chief operating officer for Advent Health, their Well 65 Plus product and population in the Florida marketplace. So much bigger scope of responsibility. We've had folks, another person who was in the consulting space is now the chief revenue officer at Lumeris. And we've had folks in hospital operations. This student was started the program as a senior director of revenue integrity for a hospital at uh, a large hospital system in California, which has now merged with a number of other healthcare systems. But she is now continued with that organization, and she's a division vice president for population health operations. So as you can see, they've had some significant career growth in their trajectory after the program. So lastly, you might say, Sandy, I'm not quite at that, director level just yet. I aspire to get there eventually, and think about how a program like this might take me further. But what about other types of jobs, and where have people gone with them? So we've had one person who was a technical lead, sort of a health systems analyst for like a data research information company related to healthcare, and he's now a technical project manager for implementations. So moving from just analyst to implementation. We had someone in the New York metro area who's a director of nursing informatics and performance improvement at his healthcare system. And he is now the vice president for ambulatory and business development at that organization. People have started in pharma, in the marketing space, or who may have been involved in just one product. But this particular individual is now a global marketing director at a large pharma company. We've had people who in the delivery space were this person is she's actually now a TA in the program. She's a quality control and improvement analyst for her company, and she's now a vice president of clinical services and support. And lastly, a person who is a manager of provider operations is now a program director for value-based care. So there's many different ways that you can think about how a degree like MHL is going to help you pursue further career development. So those are some really down in the weeds specific examples of specific different alumni in the program who have gone on to do amazing things. So now that I have whet your appetite, I'm going to tell you some more. Tell me more about this amazing program and how it does it. We're going to go over the program structure, the value and impact of the program, which we've touched on some specifics, and then help you think through, is the program right for you, and go over the application requirements and things like that. So let's start with the program structure. I'm going to give you a snapshot of what happens in our program. So the objective of our program is really to drive innovative and sustainable cross-industry solutions to today's complex healthcare challenges. We really want students to walk away with the ability to think critically about large-scale problems and solutions for them. So we do that by taking the best of healthcare knowledge and healthcare specific knowledge in terms of how we specifically get there, combined with the business knowledge that you need in the healthcare space and leadership space, and add that leadership development and course structure to develop all three of those things to really position you as strategic decision makers in your organizations. This is a picture of one of our recent classes. All of these folks have graduated, and I probably mentioned some of them while going through that list of advancements. And in fact, I see a number of other advancements as I'm looking at that group of students. All right, so let's talk about more specifically about the curriculum. So the program is delivered in 1 year over 3 what we call academic terms or semesters. And you can enter the program either in the summer or in the fall. Regardless of when you enter, you will be spending one of your summers in class, but in total, it's a one-year program. So we have 4 core classes that are what we call a full credit course, and that includes healthcare policy, strategic planning and value creation, healthcare finance, obviously a cornerstone requirement, and a course we call leadership and workforce development, and that's really about leading in organizations, in teams, as well as all of the current challenges around workforce development and sustainability, as we all know the healthcare industry is facing. So those are the 4 full credit courses. They happen to occur either in the fall term or the spring term. In the summer term, we offer a number of what we call half credit courses to get you up to speed on some really specific healthcare content knowledge. First is a healthcare marketing course. We have a specific course in health economics, sort of the fundamentals of economics and how systems work together in the healthcare space. We have a course on health law and one on quality improvement and the learning organization. So those are the 4 half credit courses that take place in the summer term. And then you'll notice that these other half credit courses here are in light colored boxes or have white backgrounds. And that is because they occur in a fully online delivery mechanism. The courses with a dark background are a hybrid, and that means they're offered partially during our residential session, which there are 3 of those, and you'll hear more about that. So you meet faculty and engage in classwork in person with your faculty and fellow students, and then complete the rest of the course in the online space. These 2 courses on technology, not surprisingly, are very tech-oriented. They are offered in a fully online capacity. You do get the opportunity to meet and interact with your faculty who are teaching the course, but the content is all delivered in the online space. And then lastly, we have 2 really important foundational series of classes that happen each semester of the program that together form 1.5 credits. And they really align and bring together all the other curriculum that you're experiencing during the program. The first is a critical challenge project, and that is our capstone requirement, where you are thinking through all of the implications of delivering a solution on a critical challenge that you either are experiencing in healthcare, in your organization, outside your organization, a new startup idea to solve a critical problem, all kinds of things. But we want that to be a personal choice by you. It's offered as 3 mini segments, one each semester of the program. And the same is true for our leadership and professional development course. There's going to be 3 segments across each of the terms. And that course is about your own personal leadership journey and developing your individual leadership skills. So you get things like a 360-degree evaluation from the Center for Creative Leadership, and you get certified leadership coaches who provide you 2 coaching sessions and help you develop your own personal leadership development plan. So you need a plan if you're going to develop. So that's what that course is about in terms of helping you think through the application of skills in real world scenarios. This is all taught by world-class faculty. And I would like to highlight here, one of the things about this program is that it's a very applied program. And you'll find that most of the faculty in this program have are not strictly academics, but have worked both in academia and in healthcare in the quote unquote real world. So when you have folks like Kirsten Langdon, who's a psychologist who's clinically practicing, You have people like Alex Glazier, who is the CEO of the Organ Transplantation Network here in the New England market. You have Mice Chen, who's a chief information officer of a local company. You have John Park, who is a marketing executive at a large pharma company. You have John Kingsdale and Marie Ganem, who have worked and still work in the healthcare policy space on a number of state and national level efforts. So really applied perspective, both from the faculty and so therefore in how they develop the coursework. We want students to walk away with practical ideas and understanding how the content specifically applies to their work environment. So the overall design is for working professionals. Folks continue to work full-time while they're in the program. We want you to be able to connect and collaborate with a diverse cohort of peers. And we do that by having these opportunities for you to be both in person and online. We want you to build those connections and relationships across space and time, if you will. So they are represent a wide range of healthcare market spaces, as you could tell from the list of alumni that I talked about. There are 3 face-to-face sessions that occur at the beginning of each semester, and then there's continuous online learning and engagement throughout the remainder of the semester. That makes us what we call a low residency program, and therefore we can be a classroom that caters to your work-life demands. You can complete coursework when it's most appropriate for you. We focus on asynchronous learning that allows you to plan for and arrange and complete your assignments on schedules that work best for you. So what do folks tell us about the value and impact of the program? So when you look on our website, you'll see our learning outcomes listed and described a little bit in regard to the curriculum and goals of the program. But what I want to focus on is what students tell us that they value about the program. And I hear this over and over again across a wide variety of students. And what they tell us that they really value about the program, first and foremost, is learning from a wide variety of peers. You're sitting across the table from a clinician, you're sitting across the table from someone who works in the pharma space, you're sitting someone who, a healthcare consultant, you're sitting with folks who might be in the regulatory space, just a wide, as wide as healthcare is, you have the opportunity to engage with and connect with people in different segments of the healthcare industry. And students really value hearing from peers who are in different healthcare spaces facing similar yet different challenges. And making those connections that they will have for life in terms of I can always pick up the phone and call my colleague and ask questions of them in terms of having that relationship. The second thing they tell us that they really value is this focus on applied learning that I've talked about. We don't want you to just learn about Medicare and Medicaid, but we want you to learn about what are the policy questions that people need to be asking and thinking about and how it affects you and your organization, particularly, on a policy level. There's, some national level changes rolling out, and you need to think not just about what is Medicare, but you need to understand how your organization is impacted and how those changes in policy affect you and how those policy changes come about in the United States in particular, but we also take a look internationally. But that's true across all of our courses in terms of how we ask you to think about applying the work or the knowledge that you're gaining in the course. It's not just about knowledge acquisitions, it's about thinking how you would apply that. And lastly, students tell us that they really value our emphasis on leadership development, both in the courseworks. So again, in that healthcare policy course, you might be asked to pretend you're the governor and outline what your policy objectives would be and how you're going to do it. Or whether it's, so that happens in all the coursework, but then there's those specific courses um, for leadership development, your own personal leadership development, your team leadership development, as well as the critical challenge project that I'm going to talk about in regard to your own opportunity to practice leadership. So again, applied, very hands-on approach to leadership development. So those are the three themes that I hear about when talking with students about what they really value and appreciate about the program. All right, so speaking of that critical challenge project, we're really hoping for students to come away from the program with some tangible results or tangible plans and impact that they can have either in their own spaces at work or in new spaces or new challenges. So it's a student identified challenge. We want each student to identify something that they want to work on. It's a practical application of the coursework and the leadership skills that you're working on. But yet all this happens in a collaborative space. So you're working with peers, professional colleagues, we connect you with other alums who might be able to help you. The faculty and advisors are all, practical practitioners in the field. So we're able to connect you with lots of resources. So it's as I say, it's an opportunity for you to play in the sandbox, to practice leadership, and yet to get lots of help and support along the way. But it really allows students to demonstrate what they are capable of and can accomplish in the healthcare segment. All right, so if this program is right for you, let's talk a little bit about our class and profiles, and then how to apply to the program. So applicants to the program have some experience in the healthcare industry, and it can be across a variety of healthcare sectors, as I've talked about. They really want to broaden their knowledge, skills, and perspective to achieve career growth and industry impact. You will find that all the students in this program really want to be in the program and are super engaged and ready to collaborate. So they want to engage and expand their network with both experts and peers from across healthcare sectors. And yet they're working full time and they need that flexible learning format so they can continue to work while they are completing the program. So we have students from all across the United States and some international students. I need to update this map a little bit. We've got someone from Tennessee joining in. We've had students from Michigan. So need to continue to fill in my map here. But in general, you'll see a wide composition across the geographical footprint. So in each class, there's generally 15 or more states represented. There are about, in each entering class, there's about 30 to 40 students, and you take those classes alongside the 30 or so students who have already started the program in some way. So you could have 60 or so different professionals to engage with in the classroom. We have generally been able to achieve a 50-50 men to women ratio. About 2/3 already hold some sort of advanced degree, whether it's a clinical degree, a law degree, an MBA. We have people with MBAs who come because they want the specific healthcare knowledge. So about 2/3 come with some sort of other advanced degree. Now, that's not a requirement of the program, but it just lets you know that you are engaging with a group of leaders who have some wide varieties of experience. We're approaching 50% students of color, and that helps you really experience healthcare from a wide a variety of lenses and experiences. And in general, students have 8 to 10 years of professional work experience. Again, that's not a requirement, but that's where we find our student population generally lands. We do ask for at least 2 years of professional work experience. And I can address that more specifically if people have questions. All right, so how do you apply to the program? We try to make it pretty easy. There's 6 basic requirements. First is the application form and fee. If you are attending this session live in person, so to speak, that will get you the application fee waiver, and that'll be automatically noted in your record. But there's a demographic information that you fill out as part of the form. We ask you to supply a personal statement which address why you would like this program, what you hope to get out of it, and how your experience in the classroom will enrich others' experience. The critical challenge statement, we ask for questions that ask you to outline what problem or challenge you want to tackle during your time in the program. And that's a part of the application. So those are the 2 sort of essay requirements. We ask for 3 letters of recommendation, and I recommend if you are starting an application that the best thing to do is put those recommender names and email addresses into your application right away, because those take the longest to receive once your application is complete. But when you enter those references, they can immediately get started on it. We take care of asking them for it and supplying them the mechanism to submit their reference. So you just need their name and contact information. We need your resume or CV, and we need official transcripts from any post-high school degrees. So a bachelor's degree is the minimum requirement, so we would need a transcript from your bachelor's degree, and then any other degree programs that you have attended and completed. For the application process, we are able to accept unofficial transcripts, which are easier and quicker to obtain from institutions. If you are accepted and choose to come to Brown, we will eventually require official transcripts. We don't have any testing requirements in regard to the GRE or GMAT or other types of requirements. The only requirement that you might run into is if English was not your primary language of instruction in your undergraduate degree program, or if you are an international student coming from a country whose primary language is not English. So you might be asked to submit a TOEFL or IELTS score for that process, but that only applies to international applicants and those who received their initial training in a non-English speaking country. All right, so those are the basic 6 requirements. You complete click the submit button on your completed application. Eligible candidates are selected for a video interview with myself and the academic director. Admissions committee regularly meets and reviews. We have a rolling admissions process, so that means that you will hear from us pretty quickly, no more than 6 weeks, but generally within a week or so, you'll have an answer as to whether you've been accepted or not. And then accepted students to hold their spot need to provide a non-refundable $1,500 deposit. And lastly, any scholarship considerations that you might be eligible for would be communicated along with the admissions decision. So you have in hand not only the admissions decision, but any scholarship that you might have accessible to you. So to recap real quickly, this is an executive format program, a 1-year constant, 1 year to degree. There are 3 residential sessions in Providence that last a week in duration. So you are not working during that week, but you're working here on campus at Brown. You get to meet your classmates and faculty in person, and the remainder of the coursework is delivered in that online format. You are a member of Brown's community. Brown focuses very much on its student community and student-led community. So we make sure that you have the opportunity to engage in not only Brown's student traditions, but other types of graduate student networking opportunities and things like that. There are two start options. So for to begin the program, you can start either in the summer term, which is just wrapping up now, and or the fall term. So you choose one start date. We are now accepting applications for next summer, 2026, for the class of 2027. So in either case, whichever format you choose, it's a 1 year in duration, May to May or September to September. So here's an example of, I'm a visual person, so I like to see how this works. For folks who would start in the summer of 2026, you'd have a couple of weeks online, then you would have your residential session, and then the remainder of your term is all online. Then it's rinse and repeat for the second term. You have your residential session, classes online, and then the last term similar. For folks who start in the summer, once you finish up, you roll directly into commencement. Fall gets a little more complicated, but you receive your degree. All of the students entering, whether it's summer or fall in 2026, will receive their degrees in 2027. So that's how that works. And here are the actual specific residential session dates and semester start dates. So we are scheduled to be in residence next spring from May 31st to June 6th. Then again in September at the beginning of the fall term, and then in late January for the beginning of the spring term. And all of this chart is actually on our website, so you can access these dates at any point. All right, so that is all my slides. I covered a lot of ground in a short amount of time, and I see a number of questions in the Q&A. So feel free to add questions, and I'm going to ask Emma to join us now and kick us off with questions.
So it looks like our first question in here is somebody who is interested in presenting research done with Brown faculty members and is asking what funding opportunities are available for that. And this is a two-part question. So they're also asking if it's possible to do a dual MPH with this degree.
Okay, so as far as research funding, this is considered a professional degree, and folks are working full time and things like that. So we generally do not pair students with researchers here at Brown. If that's something to pursue, you might consider more the MPH degree, which is a little more research focused. But that said, we have also had students whose critical challenge project was really about producing some research that got published. It tends to be more in an applied nature, but and then the second part of the question, remind me again.
Would it be possible to do
Hmm.
this degree as well as an MPH at the same time?
So they are currently separate degrees at Brown, where they're both offered by the School of Public Health, and Brown has a kind of a strict policy about um, uh, being enrolled in one degree program at a time. So you can't be enrolled in multiple degree programs. So you'd have to take, if you wanted both degrees, you'd have to take them sequentially. We have not incorporated a degree program that combines both degrees at this point.
Thank you. Our next question is asking if you can talk about how old the students are in the cohort and some more background on that.
Sure. Age ranges from mid-20s to 60. So you get a wide variety of experience and age. and again, really represented, a wide cross-section of geography from across the country. I'm not sure what other specific things folks are looking for. Generally, 50-50 men, women. Maybe 20 to 30% are clinicians, and the rest represent a wide variety of other healthcare sectors.
Thank you. Um, Going off of that, what portion of the cohort of Brown's MHL program come from social work industry?
Hmm. We have had a number of different working for an agency supporting a state government's sort of plan for disabled adults, and he implemented a really interesting uh, process. His project was all about um, creating designated paths for folks who are aging out of services, and how to create some structure around that transition from aging out of some higher level support to independence. So really interesting. So yes, I would say it's a small percentage of students, but certainly social work is represented in the cohorts.
Thank you. Our next question here. Can you give us a sense of how the courses are facilitated? Are they mostly discussion based or more professor-led teacher style?
Mm. So, as a very applied program, we think about this as almost like a flipped classroom where you get exposure to the content, and then you engage in conversations with both faculty and classmates. In the online, so in the residential portions of the class, a professor might give a 10 to 20-minute presentation or lecture to introduce concepts and questions, and then send you off to small groups to perform a small group task, a problem, a question for discussion at a smaller group table. And then there's a process that we use to facilitate you having the opportunity to hear everyone's discussions. There are also TAs for the courses, so there's access to more support resources in the classroom. In the online space, we follow a specific cadence. We know that you're all busy professionals, and so you need that predictability for classroom performance. So early in the week, there's um, knowledge acquisition, I would say. Then there is class discussion based on prompts. And I would emphasize that those discussions are not about regurgitation of content, but are about uh, questions and leader thoughts around how to address particular issues, because nobody really wants to read 40 or 50 different content responses. So it's really, the faculty have thought very carefully about those question prompts so that they promote a conversation amongst all the peers with lots of different perspectives. And then lastly, towards the end of the week, there is some type of individual assignment or sometimes a group assignment related to producing some type of work, a paper, a letter to the editor, try and make them very real world applied scenarios that you might fall into.
Thank you. Um, from your experience, what are the most important factors that you look at when reviewing an applicant? And what are some ways that one could improve their candidacy?
So, one of the important factors that we look at is range of experience. So, how have you led in a healthcare space, whatever that healthcare space might have been? And so we're looking for folks who have already demonstrated some leadership capacity. And then if you haven't had any of that leadership exposure yet, what I recommend folks to do is to ask their leaders or managers or directors for projects or opportunities where committees, things that you could get involved in to help demonstrate that you have that leadership experience when you're joining the program.
Thank you. I have a question here about the personal statement. Um, Knowing that it is required to be 500 words, is it okay to go a bit over that?
Yes, it's okay to go a bit over that. One of the things we do have a separate information session that you should watch for, which is sort of application tips and financial aid. So that's a great session to tap into if you want more specific tips on the application process itself.
Thank you. Going off of financial aid, can you highlight some scholarships that may be available for applicants?
So there are a number of opportunities. One is um, if you have a colleague who is an alumni of the MHL program and they're used as one of your references, that is a scholarship opportunity. There are um, some arrangements that we have with organizations that we've partnered with, and they offer scholarship opportunities. And then we have the rest is merit based in terms of the strength of your application and the diversity of the market segment that you represent, as we're trying to balance out the diversity of the cohort.
Thank you. Um, Another question, do you allow for deferred enrollment? For example, if I were accepted to start summer 2026, do I have the option to defer to start summer 2027?
Yeah, yes, you do have up to you can defer and have up to 1 year. However, I would note that you also need to submit additional deposits to hold your space. But yes, you can defer.
Thank you. And I have dropped the link to register for our upcoming Finance Your MHL degree webinar in the chat. That webinar is on September 30th. And um, one of the last couple of questions that I'm seeing here is, can you provide examples of critical research questions that have been addressed by prior students?
So that is one of the details that I go into on, we have a specific information session on the Critical Challenge project, and I go over a number of projects. But let me just give you two for now. So one, I mentioned earlier the professional who's the CEO of Blood Buy. And he came into the program really asking himself the question, why is the delivery system in the United States arranged in such a way that it's challenging to get blood to where it needs to be. So he was in the Houston marketplace, and they had experienced a hurricane, and he was noticing all of the calls for blood donation, and we need help, we need blood, we're having shortages, and so he asked himself, why is that, and what could we do differently? And so his whole critical challenge project was about um, thinking about a different way um, to navigate the procurement and delivery of the blood supply. So really super interesting. And he won a Harvard Prize for it, and it had a Harvard case study made out of his project, and continues to be a successful business. Another example that I would give you that's maybe a little bit smaller scale but had big impact was we had a student who worked at a critical access hospital in Washington State, And she noticed, so for critical access hospitals are small rural hospitals. They might have 20, 25 beds, and really intended as that sort of hospital of first resort when you need to get places. And she noticed that um, the opioid epidemic was significantly impacting her community, and they really needed those outpatient services and resources, but there was no one else in the community to provide those. And what she learned was that federal critical access hospitals receive a lot of their funding from the federal government, and she discovered that all the federal rules and requirements prohibited her. There's actually a financial penalty for her hospital to provide those outpatient services for opioid use disorder. And so her project and her work was about getting that federal regulation changed so that she could serve her patients and her population better. And so she worked with her local legislators, her state and federal legislators to work on getting that policy changed. And she ultimately was successful. And that so she was able to provide those services to patients in her area. And then, but obviously that impacted the critical access hospitals nationwide.
Thank you. And that looks like it was our last question.
Great. As you heard, there are a number of other information sessions that we provide. So now that you know what a powerful program this can be, we recommend that you either attend or get access to our video recordings of those other information sessions and stay in touch with us. We have graduate school counselors who can help you work through if this is the right program for you. I'm available to answer questions, and these are the ways to get in touch with us. So thank you so much for joining today, and look forward to seeing all your applications in the future.
Thank you.